101.1 FM, AM 1160, WCCSradio.com. Good morning and thanks for being with us here today. And our visit with Dr. Gopala Ramineni is brought to you by Marcus and Mack, voted the best law firm and best personal injury lawyer 4 years in a row in the Best of Indiana County contest. You can visit them online at marcusandmack.com. The UPMC Hillman Cancer Center at IRMC is an amazing place, and he's been vitally involved in it for many, many years. Good morning. It's good to have you with us.
Good morning, Todd. Great to be here. Thank you. Thank you for having me.
You know, Dr. Clark said, we're going to actually get him to come in this year. And we've finally done it.
It's been many, many years. I don't know, was it before COVID that I was here?
Yeah.
So,
It's been that long. But you know, it's interesting we put it that way because in those many, many years since you were first here, the advances in cancer treatment, we talk about quite often with Dr. Clark and the others, Dr. Villamoria. Yeah, we talk with them quite often about the advances in breast cancer detection, but the treatment has advanced very much as well, has it not?
Definitely, yes, Todd. I think, I don't know if Dr. Chitty was here. He's our radiation oncologist, and I'm a medical oncologist along with Dr. Mokumala. And in the past, we had a cookie-cutter, one-fits-all approach. Anymore, it's become more personalized. For example, patients ask me, how many days of radiation do I have? I don't know the clear answer anymore in the sense that the advances have tailored radiation. We have de-escalated the treatments. Even with surgery, we're de-escalating the treatments to get the best outcomes. And even in medical oncology, in the past, if a patient walks into my clinic, almost 100% of them, if they had a 1 centimeter sized tumor, they would have gotten chemotherapy. This is probably about 20 years ago. Mm-hmm. Now we're able to avoid chemo in about 70 to 80% of those patients. So now the prognosis and the treatments have become so good that we're trying to de-escalate, what we're doing, thereby limiting the harm. So that's the word.
When patients come in, especially first-time patients, and they've got the diagnosis, maybe they've even had the surgery by the time they come to visit with you, there obviously is a great fear factor among them. They don't know what they're getting into. And that's, I think, where the caring team members really come in, letting them know that they're here for them. And the support that they get there is as much part of their whole treatment process as anything, is it not?
Oh, absolutely, yes. I tell, women cry maybe 3 times during the breast cancer journey at least. One of it is when they get the diagnosis. The second time is, when they get chemo and they have to lose their hair. And the third time, I say, is when they get the when they have the breast surgery. So it is very important that we support them and make them feel comfortable throughout these life-changing steps. And I'm very blessed to have a great team that I work with. Most patients get the diagnosis. Mrs. Clark is usually the one giving them the diagnosis, mm-hmm. or doing the biopsies, and she's a excellent colleague, very compassionate. And then they see Dr. Villamoria, Dr. Dan Clark, and then they see us as well. Most often patients see us even before surgery. That way they know that there is a team concerted effort in taking care of them. And we have wonderful support structure with the nurses and the front office. So it's a blessing to have all that resources.
And a part of that is the relationship with Hillman. And you, of course, are the Hillman Cancer Center. That's not a small entity by any means. Hillman is one of the most respected names in breast cancer care in the world, in cancer care in the world.
That is correct. And again, blessed to be a part of it. We have about 40 cancer centers in the western PA region, and still expanding. And it's a good thing to be a part of a network as big. The advantages are you have the pathways, you have the research opportunities, and you also have colleagues that only do breast cancer that you can consult. So it's good to be a part of a larger network.
When someone comes in and they've gotten that diagnosis and they've had the surgery and the tumor or the lump is removed, they start the process with Hillman. That process, as you said, can be something that is relatively short compared to others, and especially compared to the past. But it can be an extended treatment process, and there are a number of factors that go into it. What are some of those factors?
Correct. So I always say I have a whiteboard in my exam rooms. I always say, as an oncologist, wherever possible, I need to answer 4 questions. 1 is obviously, what is it? 2 is, what stage is it? 3, what are the treatments? 4, what is the prognosis? And stage and the biology of the tumor, determines the treatment duration. So if it is someone with a stage 1 breast cancer and it is hormone driven and it's a not aggressive type of cancer, their treatments may just include surgery, radiation, and they just go on anti-hormone treatments, as opposed to, say, someone very young with triple negative breast cancer. Their treatments, even if they're stage 1, could be a very prolonged one. So again, stage and the biology of the tumor determines the duration of the treatments.
You say biology of the tumor. Are there breast cancers that are more aggressive, one more aggressive than another form of breast cancer?
Absolutely, Todd. So the younger patients usually tend to have more aggressive breast cancers, so we take them very seriously. Breast cancer in a younger woman is taken much more seriously. And usually hormone receptor negative, or cancers that are not driven by hormones, tend to be aggressive, whether it's HER2 positive. There is a receptor called as HER2, human epidermal receptor. That's the driving force for the cancer. If women have HER2 positive breast cancer, it can be aggressive. If women have non-hormone driven, non-HER2 driven cancers, they're called triple negative breast cancers. They're very aggressive cancers, correct.
By definition, I would assume that an aggressive breast cancer is much more difficult to defeat.
It used to be, and for example, HER2 positive breast cancer used to be a very difficult cancer to defeat. But in fact, thanks to a good old physician, a coal miner's son from Newcastle, PA, Dr. Dennis Slayman, we have these drugs called Herceptin that target these HER2 proteins, and we're able to defeat those cancers. And triple negative would have been a death sentence in the past, but we're getting newer treatments, including drugs that manipulate our immune system to kill the cancer cells. So we have advances like that.
Wow. A coal miner's son, huh?
Coal miner's son, Dennis Slayman. Look him up.
Wonderful.
Beautiful story. Yeah.
Wonderful. That sounds terrific. All right. So when you come in, and you hear stories like that, you read stories like that, when you come into work every day and you get some exciting news such as that, and you follow the research, are there times when you just get over anxious? This is coming, and it's going to be here within 2 or 3 years, and we'll be able to use this in the battle. I wish it were here now.
Yeah, so the one test that patients ask me, I get blood tests on patients every 6 months, every year, and, patients ask me, what do these tests tell you? Nowadays, I just say, these are non-specific tests. Cancer has to be really bad for them to show up on the blood test. But one thing that I'm really excited about is a test called as ctDNA, circulating tumor DNA. The test goes like this. We take a fingerprint of the cancer cells, genetics, and hold it on. And then I draw, let's say we have Jane, okay? Jane has breast cancer. I take a fingerprint of Jane's original tumor, and then I can keep checking Jane's blood to see if those fingerprints are present in her blood. It's called circulating tumor DNA.
Wow.
And that probably can detect cancer much earlier if it is recurred, but it's being tested. It's being validated. So we need to wait until we jump in, or before we jump in. Yeah.
It's a fascinating process. The whole culture of breast cancer treatment, the way that it is developing, is I'm sure it's very, very hopeful for you. And translating that hope to the patient is a part of the task, isn't it?
It's a privilege. Yes, it's a task. It's a privilege, and I keep using the word blessing a lot of times. Yes.
The relationship between Hillman and IRMC, like the other Hillman Cancer Centers at other medical facilities across Pennsylvania, that has to be very special and it has to be very strong, doesn't it?
It is. It's a joint venture. Both IRMC and UPMC work very closely in the background. So yes, it's a great thing to have a mutual partnership like that to serve the local community. You know, they don't have to drive to McGee or, Shadyside or Pittsburgh to get the same care, that they can receive in their backyard.
Yeah. Well, hope is one of the key words of the day. Dr. Ramineni, thanks so much for coming in to visit with us this morning. That hope is stronger every day, thanks to folks like those at the Hillman Cancer Center. We appreciate your visit.
Thank you, Todd.
It is the voice of Indiana County. It's WCCS 101.1 FM, AM 1160, WCCSradio.com. 25 minutes after 8 o'clock, Boomer Sports next, and then Josh is with us. Actually, Matt is with us from the WCCS newsroom.